everyone, and welcome back to my channel. My name is Callie Johnson and I am a certified embodied dance teacher. On today's video, I'm going to bring you part 2 on tips for how to manage your bipolar disorder. Just another disclaimer, I am not a doctor and I'm not here to diagnose you or give you medical advice, nor do I advise that you diagnose yourself. I am just here to give you some tips that have helped me along the way with my bipolar diagnosis and my mental health journey. So stick around because I've got 5 more tips that are going to help enhance your life. All right, tip number 6, finding the right medication. Before I received my diagnosis when I was up in Massachusetts, throughout my life, I had gone through a plethora of different types of medications that usually did not work and made me feel worse. Once I got checked into the inpatient facility in Massachusetts during a crisis I was having, I had told them a list of medications I had taken in the past and the effects that I experienced from it and how they didn't work for me and I didn't want to take them again. This was actually the red flag that the doctors needed to realize what was truly going on with me, and that was that I did have a mood disorder. On top of that, I was told that while I had probably had bipolar most of my life, it was probably relatively dormant, or I was experiencing a milder form of it up until when I was 26 and experienced severe trauma, which was like putting gasoline on a fire. Based on that information, they were able to prescribe me a more of a cocktail of medications to help with the symptoms that I was experiencing and for somebody with a mood disorder. When I left, I was put on a cocktail of drugs, and while it was helping with my anxiety and helped me get sleeping again, I was feeling really looped out. And so after doing that for a few weeks, I started in my outpatient treatment and told the doctor that was now my prescriber. And she decided to help me get off the majority of those prescriptions and put me on a mood stabilizer called lamotrigine, also known as Lamictal. And this was a real game changer for me. It not only over time helped give me a lot more mental clarity that I hadn't had in several years. Over the first year of me being on it, I was experiencing less severe and milder versions of my manic and depressive episodes. I do want to note that medication is a tool. It is not a cure. My medication helped me become an observer of my mood disorder, but it did not cure it. I had to take effort and use it as a way to become an observer of my life so I could make impactful and more powerful decisions based on my diagnosis. And there is no shame in taking medication or even not taking medication and going a more holistic route. However, you need to find what is right for you, and always consult your prescriber on how you are feeling on your medication and if you wish to come off of those medications. And if you are on it the rest of your life, that is totally okay. You may or may not need to be on it the rest of your life, but know that it is there for you and it is a tool that can enhance your life. However, it will not cure your mental illness. Tip number 7, keep track of your mood swings throughout the year. And while for those of us who are not as familiar with how it works, bipolar mood swings are not just an on and off switch that happen in a person rapidly all the time. They are switches that are on a much higher and extreme scale than the average person without bipolar. What that looks like, for instance, with me, I've got bipolar 2, so I go from a more hypomanic stage to a very depressed stage in a very short amount of time. So if I were looking at it from here being just kind of a normal level, my hypomanic stages would be right about here. For those with true full-blown mania, it's going to be a lot higher. This can last for several weeks, but then that switch does eventually go off, and then you will either come back to a level of normalcy if you have bipolar 1, maybe a little bit of depression, but if you have bipolar 2, you will go from your hypomania all the way down to a depressive stage, which is on a much more extreme level than most. Once I got my diagnosis, I took time to reflect on my past and to actually see when I might have been feeling manic or depressed and see what time of year that was going on and how my behavior was reflected during those states. And then now that I have it, at my diagnosis that is, I am able to take what I've learned from my past and understand that there actually were certain times a year that I'm more likely to cycle between manic and depressive states. And what I did realize and come to the conclusion was, while not all of my cycles were from previous trauma, there are several times in the year that I'm more likely to experience it based on having experienced trauma in my past and certain times of year that it might come out. So this is where going to therapy and doing energy healing is really helpful to understand why your cycles are hitting when they are and what you can do to actually heal some of that trauma that might be existing that is causing these triggers in your life. This actually leads me to my 8th tip, which is to learn to tell the difference between a manic or hypomanic episode and just feeling good. This is definitely easier said than done, and it depends on what type of bipolar you have. For those that have bipolar 1, they're going to experience higher states of mania for longer periods of time and then return to more of a neutral or sort of depressed state. Whereas someone like me with bipolar 2, I get a little less extreme on the mania, which is why they call it hypomania. It'll last for a little bit longer, but then I pass the neutrality and go all the way down into the depressive state. This is actually what made it difficult in the past for me to identify if I was actually coming up on a hypomanic episode or not, because I would be in these long periods of depression and not be able to identify if I was just feeling good or if I was about to come up on a hypomanic stage. And while having hypomanic cycles are less severe than those that have bipolar 1 and really extreme mania, it is not to be discounted, because anytime you go into these high highs, while they feel really good, you can actually go into states of psychosis. And I just want to note really quick that psychosis isn't always a result of mania, but it can happen on occasion. Always know that is going to be followed with a crash that can lead to really bad depression and worse consequences. This is why it's so important to differentiate between feeling just good and feeling manic. So anytime you're starting to feel that extra energy come up, this is a great time to observe, do some journaling, and ask yourself, have I felt like this in the past? What was I experiencing at that time when I knew in the past that I was having a manic episode? And begin to journal throughout this, and you'll start noticing the difference over time. Tip number 9, your physical health. Taking care of your physical health. While the exact cause of bipolar is not known, it is speculated that it is from a mixture of genetic, biological, and environmental factors. taking care of your physical health will only enhance your mental health. So look into your diet, sleep, and exercise. Can you make all three of those check marks? Are those all in good shape in your life? Figure out if there's certain foods that make you feel good or bad. Are you getting plenty of good rest? And then, of course, are you regularly moving your body? Make sure you're taking care of your physical health, and it will only enhance the mental aspect of it and make your life so much easier and more enjoyable. All right, folks, my 10th tip and final tip for the video. Do not be a victim of your diagnosis. While living with something like bipolar disorder or any mental illness can be debilitating, it's something you have. It is not who you are. Allow your diagnosis to empower you. I did not know that I had a mood disorder until I was 30 years old. Had I known before, it probably would have spared me some really bad decision making and multiple crises in my life. But now I know, and I take responsibility for how I manage my life, even though I operate a little bit differently than the average person. Every year, I learn more and more about myself and what I need to work on to keep myself safe and sane. Bipolar is very complex mental illness. However, we have to understand what we can and can't control when it comes to managing our mental health. You have the power to do this, but you have to take responsibility for the cards that you've been given. Do not be a victim to your diagnosis. Find your empowerment through it. I hope these tips were super helpful for anybody that is trying to enhance their mental health well-being, especially if you are dealing with a diagnosis like bipolar disorder. Please make sure to like this video, leave a comment below, and let me know if you have any other suggestions on ways that you can manage your bipolar disorder. And of course, I would be so grateful for you if you shared this video, especially with somebody that could use the help in their life right now. It is really my goal to lift any kind of stigma that surrounds bipolar and just let people know that we're normal human beings too. We just operate a little bit differently. So thank you all so much for stopping by. Make sure you hit that subscribe button, and I will see you on the next one. Bye. Much love.